Hi, I'm Sherridan Cluff, a dietitian and nutritionist at Health and Wellbeing Queensland. Today I will be presenting on an exciting initiative that we are delivering to promote healthier food and drink choices in Queensland restaurants and cafes. In particular, I'll be focusing on how we have collected and used insights from two groups of key consumers to tailor our programs and increase community engagement. Before I begin, I would like to respectfully acknowledge the traditional owners and custodians of the lands from across Queensland. We pay our respects to the elders, past and present, for they are the holders of the memories, traditions, the culture and aspirations of Aboriginal and Torres Strait Islander people across Queensland. This is Jack. He and his mum have gone out for Sunday lunch at one of their favourite restaurants. Jack is trying to order off the menu. A menu that looks like this. This menu is full of deep-fried foods, sugary drinks, and visual marketing that makes it hard for a child like Jack to make an alternative choice. Unfortunately, this is a common scenario for many cafes and restaurants across the state. Menus that offer a serve of fruit or vegetables, or promote water or milk as the drink of choice, are very hard to come by. Whilst the foods on this menu might be okay as an occasional treat, many Australians are now eating out 2 to 3 times a week. We know that frequent consumption of these types of food will have a long-term impact on kids' health and set an unhealthy cultural norm of what it means to eat out. To address this issue, Health and Wellbeing Queensland is leading the implementation of the Queensland Healthy Kids Menu initiative, which aims to support restaurants, cafes, hotels and clubs to offer healthier food and drink on their menu for kids. Through a series of practical guidelines and resources and one-on-one support from a public health nutritionist, we are driving small changes that focus on the main areas of children's well-being: reducing sugary drinks and deep-fried foods, increasing fruit and vegetable intake, and reducing the marketing of unhealthy food and drink. We want to create an environment where kids sit down to a menu like the one you can see on your screen, and they're given the opportunity to choose a meal that they enjoy, but one that will also help them to thrive. Healthy Kids Menu launched in the middle of the COVID-19 pandemic, a particularly difficult time for the restaurant industry. We've worked hard to engage early adopters, but we want to scale up and make Healthy Kids Menu the norm across Queensland. We realise that to do this, we first need to truly understand our target audience. We partnered with Griffith University to better understand the perspectives of restaurant and cafe owners and managers when it comes to offering healthier food and drink on their menu for children. We did this in 2 ways. The first was through a collaboration with researchers from the Griffith School of Business Innovation, who were conducting interviews about the industry's experience with COVID-19. We joined these interviews to ask questions about the importance of healthy eating. We built on this with a recent student placement. 2 students joined us from the Griffith University School of Nutrition and Dietetics and conducted semi-structured interviews exploring the enablers and barriers of offering healthier options for children. 12 venues participated from across Southeast Queensland, the Darling Downs and North Queensland. There are a number of key themes that emerged from this piece of work. Firstly, there is a perception that the cost of healthier food prevents restaurant owners from putting it on their menu. Secondly, the industry have a general belief that it is not their responsibility to provide healthier options, with a common statement being, when families eat out, it's a treat. There is also a large variation amongst restaurant owners in their interpretation of healthier options. When asked, some interview participants referred to gluten-free or vegan options, some mentioned freshness and the avoidance of frozen food, and some mentioned their use of organic produce. We can see that what ends up on a menu is highly reflective of what health means to that particular owner. Finally, industry sees that there is a lack of consumer demand for healthier kids' options. Their customers are seeking out those traditional kids' menu items, like chicken nuggets and chips, and they aren't asking for healthier options. This last theme was particularly interesting to us, as much of our past research and stakeholder engagement has told us the opposite, that parents are seeking a healthier choice. So we decided to dig deeper. We have engaged a market research company to explore what Queensland families really want, need and expect when it comes to eating out. The market research company surveyed 750 Queenslanders from across different parts of the state via an online survey distributed to parents with children aged 5 to 12. The research covered not only cafes and restaurants, but also schools and sport and recreation centres. Health and Wellbeing Queensland co-designed the survey to address the critical questions that drive engagement in our programs. Do parents actually value healthier menu options when they go out to eat? What is the biggest barrier to making healthier choices? And importantly, what can governments do to support families to make a healthier choice in these settings? Themes and insights emerging from this research are expected in mid-2022. We will use these insights and those gathered from our industry engagement to adapt and tailor Healthy Kids menu to better support both the industry and consumers, increase program engagement, and ultimately create environments where kids like Jack can enjoy a nourishing lunch at his favourite restaurant instead of chicken nuggets and chips. Thank you for listening. Please contact me if you have any questions or sign up to our newsletter for regular updates.